two main things that I would like to share today. One is around our initial preparations regarding mass vaccination, and a second is an executive order that I'm implementing today around ensuring that employees have a safe environment at businesses to understand the rules around COVID and return to work. So with mass vaccination, maybe I could hand it over to Director Bond just to give a brief update on how we're thinking about vaccination in general and what our strategy is going to be moving forward.
Okay, great. Do you want me to elaborate a little bit on the executive?
Yeah, well, let's do mass vaccination first, and then I can talk about the executive order.
Wonderful. So the City of New Haven Health Department, we are working collaboratively with our region and the state to develop a mass vaccination plan. We're happy to report that our mass vaccination plan is underway and has been drafted for review and approval. We are going to be looking to vaccinate in different phases. So first phase, second phase, and third phase. We are looking for the first phase to focus on first responders and healthcare professionals. The health department specifically will be supporting first responders. What we do know at this juncture is that we will be making announcements for the different phases for the different populations as the vaccines become available. As you know, there are a number of trials underway. However, there's two contenders that are in their final stages for approval, which are Pfizer and Moderna vaccine, and hopefully they're under the EUA and issued by the FDA. Once that is approved, we will be able to then provide some education and awareness around the vaccination, specifically the ones that we will be administering. We will be following the cold chain commands and making sure that we adhere to that. And our plan also consists of how we will execute and vaccinate. The vaccine, what we know right now, are going to be given in 2 doses and separated within the 2 doses within a specific time period. And right now, we do not know if we're going to have limited amounts initially, but what we do know that between the Governor's Vaccine Advisory Committee, along with the different regions in Connecticut, we will ensure to execute in a timely fashion and be able to provide the latest information to allow individuals in the community to make viable decisions on what's the best option for individuals and their families. And so we're really excited that we worked really hard with our nursing team and our planning committee on this plan and are looking to ensure that once we have the final approval of the vaccine, to provide that information to the public so that you will be able to make the decisions that are needed.
Thanks, Director Bond. The second main thing is an executive order that I signed just about an hour ago. And the goal of the executive order is to ensure that employers in New Haven are implementing proper COVID policies. We've noticed that a number of establishments are not properly doing health screenings for employees, not properly advising employees when they're symptomatic that they should go home, how long they should stay home for if they get a test, when they should be coming back to work, so proper return to work policies. And so this executive order is meant to ensure that businesses are abiding by policies that both keep them in operation and also protect their employees. There's a number of components to the policy. The first is that employers with in-person workers are required to develop a return to work policy as recommended by the CDC. And the return to work policy should cover things like protocols for employee health screenings, leave and return to work policies for symptomatic and COVID positive employees, and things that we're very familiar with: social distancing, hand washing, and other employee policies. They're required to post this policy so that the employees are aware of it and know of it. And there also, the second important part of this policy is to report to the health department any cases so that we're aware of potential outbreaks and can help support employers to ensure that the outbreaks or individuals don't become much more of a significant outbreak. The policy, even though I'm signing it today, will go into effect on December 7th. And we realize that there's a lot of strain on businesses right now. And so we want to make this as easy as possible. In reality, this is not a huge lift. It is something that our economic development department and our health department have worked to help support. And I'm going to ask Mike Piscatelli in just a moment to share some of the ways that we're helping support businesses. But this shouldn't be a huge lift. Businesses should be reporting to the health department. That's a pretty easy ask. And also businesses should be making sure that they have appropriate policies to keep their employees safe, both those employees that are sick, but those employees that are not sick that may potentially be exposed to other employees if they come to work and even if they come home but come back in a few days when they should be isolating for a longer period of time. Mike, can I hand it over to you to share some of the work that you've done to help support businesses?
I'm sure, and I'll introduce Ginny Kozlowski, who many of you know from our Economic Development Corporation, on the call as well. Thank you for the time. Obviously, it's been a very stressful time for many businesses, both those that have been fully open and essential throughout the pandemic and those that are following various reopen protocols. So it varies from business to business. And I think one thing we've learned through this process, particularly as this executive order is moving forward, is demystifying and clarifying the roles and responsibilities of the employer in the process. So tomorrow we'll host a webinar at 1 o'clock in the afternoon. We'll have HR professionals as well as Director Bond, really to focus on three main areas. One is the CDC guidance concerning returning to work. And then the second regarding the pre-screening protocol that employers are required to go through with their employees that return to the workplace, those that are reporting in person. And that includes both the employee and any contractors that are on site as well, to make sure that we're covering the people most on site at any one given time. And then finally, the piece that is new today, and one that I think we're learning is very, very important, is making sure that the reporting protocol is tight and it gets back to the health department in a manner that can support the overall efforts to protect the rest of the employees through the contact tracing and assessment of the situation itself. So it's a bit of a teaching exercise, and it's obviously comes on the heels on a lot of other stuff that's happening, bouncing between 2 to 2.1, 3 back to 2.1, and making sure that there's some clarity around the rules as we go in through a really tough stretch here through the winter.
Thanks, Mike. Does anyone else on the team have anything to share, or are we ready to open up to questions? Okay, let's open up to questions. Go ahead, Paul. You're on mute. Paul, you're on mute. Oh, okay. There you go.
Hi, everyone. Starting with the executive order, I get a sense that this might have been prompted from instances where these rules weren't being followed. We were told that Walmart people were sent home and came back and weren't told. Can you tell specific instances where this wasn't followed and how widespread, and does it include the post office in Amity?
Director Bond, you want to give that a go?
Yeah, and this is certainly not to blame one sector over the other. When the reopening guidance was issued, the onus was really left upon the employee to report. So while some businesses were just automatically reporting to us, it wasn't consistent. So this executive order just really aims at making sure that we have a consistent, streamlined mechanism so that we can provide the support that is needed to businesses in making these decisions on isolating and quarantining and what's appropriate. And then also the opportunity for us to be able to provide really technical support in reviewing their protocols that they have in place.
Is there fines, like you're going to be fining people? Is there a dollar figure?
There are no fines in place for this executive order.
So what happens if they ignore it?
Well, there's different avenues that that I can take for any licensed establishment.
Yeah, this specific language in the order is that the New Haven Health Department may issue a closure order or revoke a city-issued license to any establishment that fails to meet the above required reporting protocols and procedures. And I mean, I think the short answer to your question, Paul, is yes, there have been a good number of examples across the city of establishments. By and large, what I have seen is that establishments are very, very cautious when an employee gets COVID, and a lot of them just shut down, but they're doing the right thing. But there's been enough examples that we were concerned enough that we felt like this is a necessary step. Other questions? Go ahead, Paul.
On the issue of mass vaccinations, you said you have a plan. First, I want to make sure I got it straight. You've completed a plan, but because there are details that we don't know, such as how much we're going to get, you're not revealing at this point what the phases are after the first one, correct? Like who goes second, who goes third?
Correct. So there's a number of variables with the mass vaccination plan. There's mass vaccination plans that are going to be established and created by the different sectors. So hospitals will have their mass vaccination. Local health will be specific to providing to the community that we will be allocated. And also we're waiting for the official approval of either Pfizer or Moderna. And so once we get some finalized information and also the targeted population that the state wants us to focus in on, we will finalize the plan. And so right now the plan is up for a final review at the state level. And then also once we get those other logistical pieces, we will then finalize the plan on our end. But the good news is that we have a plan in place that includes, just assessing capacity and readiness to be able to execute relatively quickly.
And so is this about shots you'll be administering, or is it also coordinating ones that Stop and Shop and the hospital administrating? Like you talked about, are you physically, the health department, going to be giving the cops and the health workers the shots, or are you going to be coordinating with New Haven and Stop and Shop about who's given what?
Each of us are going to be given a different target population. So the Stop and Shops and such will be general population, just like they are able to administer flu shots. Hospitals are going to be targeting healthcare professionals. We will be targeting vulnerable populations and our first responders that we service in our jurisdiction. And so every single sector, community health centers will be having their specific population that they will serve. So each of us are preparing mass vaccination plans that are customized to execute based on what we're being guided from the state.
You mentioned vulnerable populations. Have you identified concerns about people not trusting, especially minority community, science or the medical establishment? Does your plan include countering misinformation or concerns people have about taking the vaccine?
Yeah, absolutely. I think that's something that the mayor, Dr. Bilal, we talk about continuously, is making sure that we have a risk communication plan in place and that we are providing the most valid information that's accurate, timely, science-based, so that people can make their individual choices. As you know, this vaccine will not be mandated. However, we want to make sure that just like with COVID-19 in general, and some population thinking that it was a hoax initially, we want to make sure that when the vaccine is approved and we have all of the information that we need, that we then also share that information transparently to the community.
Yeah, I think that just in general, as far as building a trust around the vaccine, the first thing is our team is going to assess the data that comes out once a vaccine is approved, to have a deep understanding of the potential side effects so that we can share that information with the community. The second is on the leadership side. Director Bond and I have talked about how we need to be the first in line to get a vaccine because we want to show that we're willing to get the vaccine ourselves because we believe it's safe. And then the third is sharing the message with the public and ensuring that other leaders in the community also are willing to step up and make absolutely clear that the science is valid and the vaccine is safe. I saw Kyle. I think you had a question.
Okay. So question for you guys on both of those items that we're talking about. So first on the vaccination plan, the ACIP recommended that residents of long-term care housing get vaccinated first in addition to healthcare workers. So will New Haven include those residents along with the first responders and healthcare professionals?
So the New Haven Health Department will be charged for a specific population. As you know, there are specific sectors currently testing on a routine basis for the long-term care facilities. So the state has not yet determined whether those existing partners will just go ahead and vaccinate because they already have that existing relationship, or if the local health department will also assist. So that is yet to be determined, but they are prioritized.
Okay. And then as far as the businesses, have you guys issued any fines lately for any businesses for COVID violations after the governor allowed those fines to be administered by local municipalities?
Yes. So I've issued about 12 warnings and three infractions.
But can you be clear about the level of the infraction so that the press doesn't report that we issued three $10,000 fines?
Yes, we issued, let me clarify. So as you know, we have a two-tier system where we issue a warning letter. And then the second is an infraction when we already have issued you a warning letter. And so we've issued 12 official warning letters of mask violations. And then the infractions were $100 violations, two to the same business and one to a separate business. And they were each $100.
Okay. Any way we can find out what those businesses were?
Is there an issue with sharing the names of the businesses?
Nope, I will
Okay.
make an email request.
Gotcha.
Okay. Kyle, do you have any other questions?
No, not right now. Thank you.
Okay. Paul, I don't quite understand your question. What is in the comments? What is time frame?
Estimate those over what period of time were those 12 warnings and 3 infractions?
Since the launch of our announcement a few weeks ago, we had issued 12 warning letters. And then in the last 4 days, we issued the 3 infractions.
Good. Any other questions? Go ahead, Paul.
So on COVID, in terms of what you're urging people to do, you've asked the governor to have more serious restrictions as doctors have about indoor dining. You had a press conference this week where city officials were urging people to go inside local stores to shop, saying there's no way to compare the experience of going in a store and shopping. And I was just wanting to get clear if you are urging people to go indoor to stores or if you're urging them to do sort of like buy, take out an order by phone and mail.
I heard this, this is a roundabout way of answering your question, but I heard this great interview on NPR about someone having a certain amount of risk in their bag. And as you do risky behaviors, the amount of risk that you have left gets smaller and smaller and smaller. And so some of this is on the individual to determine how much risk they're willing to put themselves in, right? If they're interacting with a large group of people because they're perhaps working at a grocery store, they don't have a lot of more risk to share in different environments. And so some of this is making sure that people are as much as possible reducing their own exposure by taking fewer risks themselves. The second part of this is about the data of where we're seeing outbreaks happen and cases spread. And there's a decent amount of data that cases are spreading in restaurants. The state did an investigation of 69 clusters in Connecticut, and 20 of those were at restaurants. That was the most common next to private gatherings and other establishments. Several Yale School of Management professors did an analysis of many communities across the nation and whether they had restaurant closures and other establishments closures and how that impacted the spread of cases. And the indication was restaurant closures reduced significantly COVID outbreaks. Oddly enough, retail establishments, including like coffee shops, actually their data showed slightly increased the number of cases when they were closed, and their speculation was because perhaps people were looking for other types of riskier leisure activities. But nevertheless, their data pretty strongly indicated that restaurants were an issue. So I would encourage people to do takeout and delivery. At the same time, I think that, you know, an individual going with a mask into a store to purchase something, their level of risk is not very high. I mean, I do that when I do takeout, right? You can stay 6 feet away from someone with a mask on and get your food and leave, or get whatever purchase you want and leave. I think people need to be wise about not going into a store where there are a lot of people. But we want to support our economy as best we can in a safe way. And I think that the messaging around this is based on the science and consistency.
Nuance.
Anything else? Keep going, Paul. We got all night.
I like the last answer. A lot of nuance. That was good.
Yeah, it's tough. So any other questions from folks? Otherwise, we'll pack it in. Okay. Great to see everyone. Thanks so much.
Stay safe.
All right. Take care.